love working with the families and the patients. Kids are remarkable. They bring a joy to my soul.
For me, it's just been a thrill for literally decades to watch my patients grow up and then become parents themselves, and then I have the chance to care for their children.
This is an exciting time for the Rush University Children's Hospital. We are expanding our clinical services through partnership with community hospitals, and we are creating new training program for the future generation of pediatricians.
We are focused on education and on research, and these are pillars of our training.
We are strong in each of these realms that are important in an academic medical center. We also do the research to make sure that we can come up with the best treatments and best strategies for our patients, including how to diagnose and manage their illnesses.
We came to Rush in December of 2011. Ricky was diagnosed with Ewing sarcoma, which is bone cancer. Really a week into Ricky's treatment, we found out that the cancer had metastasized to his liver, and there was really no other information about metastasis to the liver for Ewing sarcoma. Usually it would go to the lungs.
We specialize in taking care of families with children who have chronic illnesses and have medically complex diseases.
Our oncologist had the entire medical team working on that, the interns, the med students, and they were researching what the best approach was in order to treat Ricky and get him to a healthy state.
In the way we deliver care at Rush, through family-centered care, we recognize that each family is different, unique. We recognize that family members know better about the needs of their child.
When we make rounds in the morning, we include the parents in the rounds so they get to hear everything we say. And at the end, we give them the opportunity to ask us questions, voice their concerns.
Child Life Services addresses the psychosocial and developmental needs of children and families while they're in the hospital to help them cope with illness and hospitalization.
We had to learn about chemo, and the nurse that we had that day took us into a room, and she walked us through the entire process and really answered any questions, and honestly was one of our favorite nurses the entire time.
In anything that we're planning, obviously the patient is at the center of that. Understanding what will make it easier for the patient when they're here.
My husband Dave and I are involved with the Family Advisory Board, and it's giving a perspective to the hospital that the hospital can't give themselves because they haven't had a child that's been cared for.
We want to make it as comforting as possible when you're dealing with tough situations.
One of the most important things that we had when we were here was care from an entire team. It wasn't just the medical professionals that treated us. The child life specialist, the receptionist, the admission clerks, the maintenance people were always very caring and asking how things were going and really took good care of us. There were so many nurses that did so many things to make Ricky feel special along this treatment journey. I called them Rush Angels. And when we finished treatment, I actually did call all of those nurses our Rush Angels.
I would tell kids to tell their parents to go to Rush.
I have an exceptional team of people working with me. Exceptional nurses, physicians, residents, staff, health care providers. It's been exciting for me to find such dedicated people to make a difference in children and families' life.